SFH is dedicated to improving the healthier lives of Rwandans through health services and products, using various methods like social behavior change communication aimed at increasing health-seeking behavior even in hard-to-reach areas. SFH programs are implemented at all levels, especially at the community level. The interventions aim at empowering community members to become agents of change, but also to support local leaders to create a conducive environment for behavior adoption. Although 2021 has been challenging due to the COVID-19 pandemic, this did not stop SFH from reaching its targets as planned. Let's all celebrate this year's achievements.
We are so excited for what we have been able to achieve this year. So far, we have had an amazing team. We have had amazing partnerships, right from multilateral partnerships, different foundations, different private sector engagements and partners. And all our achievements have been as a result of a combination of multiple factors.
SFH has implemented 4 projects, starting with Muzima Bwiza, Shema Lyanje, that is being implemented in Gatsibo district, where we are promoting HIV prevention among adolescents 15 to 24 years of age. Another project that promotes SRH services is Ingobyi, that is implemented in 20 districts. And here we trained all the schools in Gicumbi and Rubavu how they can improve their comprehensive sexual education program. We also have Enable projects in 8 districts, where the aim is to support youth-friendly services provided by youth centers. Lastly, we have SFH Rwanda, where we have deployed a digital platform that is available and supports docents or the students access information on SRH, as well as link them to pharmacies where they can easily access health products, including contraceptives.
This year, we are blessed to have our partners in the US government, the USG, the CDC, USAID, DOD. We have also had our partnership with Enable, the Belgian government. We have had a partnership with the government of Japan, through the Embassy of Japan, which has been really an amazing new partnership in terms of health systems strengthening. And we have tremendously achieved a lot of outcomes and health indicators as a result of these partnerships.
As the world, including Rwanda, is still struggling with the COVID-19 pandemic, other diseases like malaria have also continued to pace or increased. It is on this basis that SFH has not withered its efforts to provide health-saving products and services to the communities across the country using various information, communication, and education approaches and channels.
Under malaria prevention, we are conducting a social behavior change communication program in the eastern region or districts, and this is being done through community level intervention, working in partnership with community health workers, but also the mass media using radio programs.
Hano muri Narama tugenda duhura na resistance y'abantu bitwa ko batuye mu miji, ariko ku bufatanye na SFH mobilization igenda neza.
The key indicators were reduction of severe malaria cases, reduction of malaria deaths, increasing the number of mosquito net distribution, and also antenatal care visits. The partners under this program really are the community health workers, RBC, the local authorities where we implement, and the engagement was basically done through meetings and supportive supervision of the field activities.
Nabonye rero amahugurwa ya SFH ngira ubumenyi kuri malaria yongera kubwo nari mfite. Muri ayo mahugurwa harimo kurandura malaria burundu dukoresheje gukuraho ibidendezi, gukuraho ibihuru byegereye ingo, no kurara mu nzitiramibu ikoranye umuti no guteresha umuti wica umubu utera malariya.
Abajyanama b'ubuzima badufitiye akamaro kanini cyane kuko mu bijyanye no kwirinda malariya harimo ubuvuzi baduha tubonera mu buryo bwa bugufi nyine hano mu mudugudu iwacu. Baduha bayigoni zidufasha kuba imibu itakwirakwira mu mazu, bakatugezaho n'amavuta twisiga nayo aturinda uwo mubi washobora kuba waturuma.
The Ministry of Health and RBC have been working with SFH Rwanda mainly in disease prevention and control. For us, we are focusing on malaria control countrywide, whereby we have different activities including SBCC. They are implementing mainly in the Eastern Province, where we have the high burden district, but also in other districts they are supporting mainly in a mosquito repellent product distribution and the bed net distribution to those in need. And recently we've been working with them on a new project for live siding in Kigali city, where we are using drones for mosquito control. In Eastern Province, you can see that since they are implementing SBCC, working with the community health workers and health facilities, the coverage went high compared to before that partnership. This is one impact we can see, but also we could see an impact in reducing malaria cases. My key recommendation to SFH would be keeping the current effort, but extend to more districts, but also where possible, we can even increase with them the package offered in those health facilities, those health posts.
SFH Rwanda, being a local health non-governmental organization, has expanded its operations cross-border by supporting the Great Lakes Malaria Initiative, GLMI, in the fight against malaria to establish and strengthen health posts across different borders of EAC member states plus DRC. GLMI aims to contribute towards the control and elimination of malaria and reduce its morbidity and mortality by 50% by 2025 from its 2019 levels in the Great Lakes region, with a special focus on the cross-border communities. It was officially launched at regional level in Nairobi, followed by the Rwanda GLMI launch, which brought together malaria program key players and partners, high-level officials, and malaria program experts from EAC member states plus DRC. The two launches were successfully implemented and supported by the SFH team, from planning, organizing, and implementation.
I'm so excited to report that we have been able to launch the strategic plan, the 5-year strategic plan, and the official initial launch was done in June 2021 in Nairobi, Kenya. We are so happy to have the chairman and CEO of SC Johnson. We are so happy to have the leadership of East African community, and it was exciting to also be with the Cabinet Secretary of Health in Kenya, Dr. Kagwe. So really, this worked as a springboard to launch even other national launches. Recently, we had also exciting, very successful launch in Kirehe, and we are moving forward to have other cross-border launches so that the people at the borders, the border communities can co-own the interventions, can collaborate with the ministries of health, and can be able to implement these activities. And as SFH, will be playing a collaborative role, technical support role, coordination role, and the resource mobilization.
Under the CDC project, we've had a number of achievements. From the testing, we have tested 67,795 key and priority populations. Of these tested, 2,342 were positive, and these we have helped to link to antiretroviral therapy. Other than the testing, we've also initiated 6,601 female sex workers and adolescent girls and young women on pre-exposure prophylaxis. We also distributed HIV self-test kits, and the number is about 18,800 HIV self-test kits. The approaches that we use to achieve our targets involve working with KP peers who mobilize for the activities, and we also work with the health workers who offer the technical services like testing and linkage to ART. And then we also work closely with RBC, CDC, and the Ministry of Health when it comes to tools, reporting, and related activities at that level.
As a leading social marketing and social behavior change organization, SFH is working with various actors, particularly the government of Rwanda, to support the universal health coverage.
Muri sales and distribution uyu mwaka turishimira ibyo twagezeho ko produit zose twageze hafi kuri 90%, uretse produit imwe yonyine yitwa Siro aho tutabashe kugera kuri target kubera ko yari yabuze kubera ibibazo bya COVID. Urebye muri rusange produit zacu zigera ku muturage duhereye ku bagorusiste dufite muri buri karere, akagera abasemi horusera ku murenge na boutique ya nyuma iba muri quartier ariho umuturage yabona produit zacu.
Note that all these interventions combined are in line with SFH's mandate of achieving a sustainable health impact in Rwanda.
We are determined to move forward according to a strategic plan, according to the strategic guidance from the Ministry of Health, Ministry of Youth, Ministry of Local Government, to do what is right and to correct what does not deflect to be fitting at the right conditions of the day, because we believe in data-driven decision making.